how to approach MBBS first year by the favorite faculties of the students, Dr. Azam, Dr. Naveen, and myself. Dr. Azam will be talking about anatomy. Dr. Naveen will be covering physiology, and I'll be talking about biochemistry. So this is a very, very important session because when you enter the MBBS, there's lots of confusion. Which books to read, how to approach the questions, the new curriculum, what points we have to keep in mind. Your seniors might not be able to help you because they have not seen this pattern. So there's some more important questions which will highlight. These are common doubts in the mind of all the students, and we'll try to give very comprehensive solutions to these common problems that most of these students have. So initially, I'll hand over to Dr. Azam to start some of the doubts which are commonly presented to us by the students.
Thank you,
Dr. Azam.
Thank you, sir. Thank you. Welcome all of you, my dear students. First of all, I would like to welcome all the students who have just now entered into the medical field, who have entered into the medicine, the world of medicine, I should say, and one of the noble professions, guys. So all the first year MBBS students who have now just started their MBBS in the first year. In the first year, you're going to come across like 3 subjects: anatomy, physiology, as well as biochemistry. And in that, first of all, anatomy, when it comes to anatomy, like most of the students, I don't know why, in the first year, they have a lot of phobia. Comparatively, I'm telling you, comparatively, like compared to physiology and biochemistry, when it comes to anatomy, they'll be having a lot of phobia, that it's all about mugging up. So first of all, I'd like to tell all the first year MBBS students across India, or even outside India, wherever you're studying. So in the first year MBBS, please don't have a phobia of anatomy that you're going to just memorize or mug up that thing, guys. Why? Because, yes, welcome at Doc Tutorials and just watch my videos. You'll come to know anatomy is like very much conceptual. It's very much conceptual. It's about the way how you approach the subject. So when it comes to anatomy, the first thing I should tell you that don't have that phobia in your mind that it's going to memorize. So just welcome and watch my videos. Then you'll come to know that it is very, very, very much conceptual, guys. And second thing, later on, I will even tell you about like what are the things that you have to approach, like how to go ahead with that one, like which big books to refer to, and how you can use the videos to, make the subject a little bit easier than this one. So let's get started. Let me even introduce our physiology faculty to you. One of the renowned faculty, national faculty throughout India. He's having his, a lot of fans across India. Yes, sir, Dr. Naveen, sir. Welcome, sir.
Thanks a lot, sir. Dr. Ajam, sir, thanks a lot. So I always say that if someone asks you that what is the center of cosmos, then the answer will be the spinal cord, because everything we perceive through the spinal cord. Similarly, I always say that physiology is just like the spinal cord, because if you understand the concept of physiology, only then you are going to understand pathology, pharma, as well as medicine. So it is forming the base of all the medicinal science. Okay, for example, if someone says that in hypocalcemia, there is carpopedal spasm, but physiology will tell you how it happens. So if you have a better concept of physiology, it will not only help you in passing your physiology examination, not only help you in passing your NEET PG examination, but also helping you to become a good doctor, as a good physician, as well as to understand the basics of your medicine. So for that, we all are 3 are here to help you out, because there is a paradigm shift from NEET PG to next. We all know the pattern of question has changed completely. Okay, we and Dr. Ajam sir and Nilesh sir were discussing. If you see the current paper, almost they have changed the whole scenario. Now they are not asking the write an essay on shock. They are giving a scenario. They are not asking the regulation of BP. They are giving you a clinical scenario. So you must make out when to write what. You know everything, but to correlate physiology with the clinical scenario is must. So for that, we all 3 are there. So we will discuss what are the standard books and how your videos are helping there, and also how to approach to the study, because labor is not needed. It should be a smart study. It should be smart study. In less time, you have to cover almost everything. There are 3 subjects in first year, and we have not more than, 1 year, less than that. So I always say that you must know everything sequence wise. Should not be like that. You start reading Guyton and go on from A to Z. No, there is a curriculum. We know the topics. So we should study topic wise. So all things we will discuss. So now I would like to ask Dr. Nilesh sir and Dr. Ajam sir that what are the standard books for your subjects? First of all, tell me. Because there
Yes,
are so
sir.
many books.
Yes, sir. Yes, sir. Like first of all, I'd like to add, first of all, starting from anatomy. See, guys, I'll tell you, in first year MBBS, like most of the students, they'll be taking guidance from their seniors or some other sources. And they will come across, like, what are the standard books for anatomy? Of course, Gray's Anatomy is the standard book, the Bible of anatomy, as I say. And there comes other standard books also. But saying that, I would like to tell you that please don't start directly from the standard book like Gray's. Okay. First of all, start from the simple books, okay, or the basic books, I can say. One of the basic book which is followed is B.D. Chaurasia, as well as Vishram Singh book is followed. So that is a book that you have to follow for your anatomy, guys, to begin with, to start with. Okay. And then later on, for, like more in-depth knowledge regarding that one, then you can just read the Gray's like a story there. Once you get the concept properly in B.D. Chaurasia, or else you can also follow the Vishram Singh book, guys. Acha. Now, just breaking down, first of all, when it comes to anatomy is actually a very huge subject when it comes to your first year. Why? Because it is not like single vertical that you are dealing with. We are actually dealing with gross anatomy, where I hope you have heard about that. If you have entered into your first year MBBS, in the first month, you'll get to know that in India, we are actually going to deal with regional anatomy, like upper limb, lower limb, thorax, abdomen, pelvis and perineum, head and neck neuroanatomy. So we are going to deal with region wise, not system wise. There are certain countries where it is dealt in system wise in first year MBBS, but here it is done in regional wise. And apart from that gross anatomy, then you also have embryology, developmental anatomy, then you also have histology, and then we also have osteology. And then starting with all these things, we'll be having a small book for general anatomy, guys. Now, first of all, let me just divide all these things into these parts, and let me tell you the books, the standard books that you need to follow. For gross anatomy, the best thing is that go with the basic books like B.D. Chaurasia or Vishram Singh. And then later on, if you have time and if you have interest, then you can just go through in-depth through Gray's Anatomy. Then coming to embryology, for embryology, one of the standard book for the embryology will be Langman Embryology. But of course, you don't get everything only from the Langman Embryology. That is why when you watch the videos at Doc Tutorial, especially which are curated for UG curriculum, we have actually recorded all the 3 faculties in front of you here. I've recorded the videos for UG curriculum also. For that, I have actually, for embryology, it's like a mixture of Langman's embryology, even IB Singh embryology and all those things. Then later on, histology, we have Dr. Paul Sir histology book there is there that you can follow there. And then if you have a very good one atlas, Grant's Atlas or Netter's Atlas, if you have that thing, I think that is more than enough. But guys, I'll tell you one thing here very, very clearly. Don't go directly to the standard books. Always start from the basic book. And for that thing also, I'd like to tell you that I think other faculties like Dr. Naveen Sir and Dr. Nilesh Sir will agree with me that even for reading B.D. Chaurasia also, first of all, you should actually just go through the video first of all at Doc Tutorial. Then once you get an idea, then you can actually go and read the book. Then you'll understand like what exactly they're going to tell you about. For example, I'll give you just one example, then we'll go to Dr. Nilesh Sir then. For example, in neuroanatomy, we have one basic topic, spinal cord. And spinal cord is one of the important questions for your prof exams also. Now, in the spinal cord, if you just go through B.D. Chaurasia, it is written like paragraph by paragraph by paragraph it is written there. So once you see my UG curriculum videos, in that it is very clean, neat and clean, sorted out, like what will be the extent, then the length, then the shape of that, the enlargements of that, the ending part. So that is sorted out. So you can just go back after this video and open the B.D. Chaurasia book. It's given like paragraph. So as a faculty, we are actually trying to come in between your book and you. And we are trying to simplify the thing, decode the thing. So the best hierarchy, the best order will be first watch the video, then you'll know how to approach the topic, then go for the textbook, basic one, then go for the standard textbook. That is how I would like you to follow the things, guys, in your first year MBBS. That will make your life easier. Yes, sir. Up to Nilesh, sir.
I want to ask you, sir, the number of books in anatomy, just like a syllabus, it should be a whole course, I think. So
Yes.
is it possible to cover so many books for the student for MBBS? And is it reasonable to read all those books? Or can you just summarize few books or few things which can be read from Grey's Anatomy or Listeners, whatever, like this? Because in 1 year, you have to study anatomy, physio, and biochem.
Exactly, sir. Exactly. My last point was based on that one only, sir. That the order which I told them. Suppose if a student actually goes and studies one particular topic, actually what is going to happen in anatomy? Anatomy textbooks, aapko to pata hi hai, sir, like the kind of language they'll be using. Immediately in first year MBBS, a fresh young medical student after completing +2, coming into MBBS and opening those standard books, the language itself will be very much complicated. So just to simplify that thing, yes, you can just go and watch the video there. In that, everything will be in order. Then what can happen, sir? Those textbooks, the vast syllabus will be actually getting concised. Otherwise, the moment the student opens a textbook and read the complicated language and all, and within like one day, he's not even able to complete 1 or 2 pages from that and understanding the concept. So better watch the video first, go back and approach the textbook. And yes, of course, I'm telling you, they can easily go through the entire textbook. They can easily go through that one, sir.
Dr.
Yes,
Nilesh,
Yes.
Nilesh, sir,
So for
put some
anatomy,
light on like what are the important books to be referred for biochemistry, sir.
yes, I'll take that. First, concluding with Dr. Azam, what he said. So for anatomy, approaching the books directly would be very, very daunting for you. And Dr. Azam has very beautifully broken down with lots of animations, flowcharts, diagrams, all the content. So his videos are a treat to watch. You must watch them before you approach your books, whether it is a standard textbook or the Indianized books. So it will help you a lot to conceptualize, to imagine, to bring in perspective the content you are reading for the anatomy part. For biochemistry, before I mention the books, I would mention a little bit a very simple point. When you look at the content in the biochemistry, it appears very, very familiar because in your 11th and 12th, you have talked a little bit about the cell biology and the various mechanisms, the pathways, the systems you have discussed. So it appears quite familiar. You have talked about DNA and RNA also. But the problem here is that in our syllabus, we have to go a little bit into the deep. So a lot of students end up having this problem that throughout the year they think, okay, we know this, we'll be able to handle an exam. But when they near the exam and they start going through the books, they realize that, oh, it is much more than what we were thinking. So we are giving this information to you in the beginning that please cover your biochemistry syllabus from the beginning only. Don't leave it for the end with the thought that it is very familiar, it is easy, and we'll be able to cover it in a very short duration of time. This is a common mistake a lot of students make, and then they have problem near the exam. Okay, talking about the standard textbook, the classical standard textbook is the Harper's Biochemistry. It is the gold standard for the UG students. But again, just like any other standard textbook, it is quite difficult to approach as a first reading material. You need to be a little bit familiar with the content before you can assimilate the information, because the text in the Harper's is very, you can say, heavy text. It has a lot of information. It is rich in information, which is conveyed in quite a little amount of the paragraphs. So absorbing all of it can be difficult if you have not had the familiarization to that topic. So again, just like anatomy, you have to have some Indian reference books which are easier to understand, which are written more lucidly. But same thing applies as for anatomy. If you can see, visualize the content you are about to read, it is easier and longer lasting grasp that you get from the subject. So here also we would recommend that you go through the videos that I have made. I have broken down the content in a very simplistic flowchart sort of thing. So when I talk about any topic, we will break it into parts, how this thing starts, then what are the parts that you have to keep in mind, and finally what is the take home message from that particular topic. So once you have that picture in your mind, and when you read it from the book, it becomes very, very, very easy. So for Indian books which you can use, one is Dr. Dinesh Puri textbook of biochemistry. A lot of students prefer the Dr. Satyanarayan's book, which is another good book to use. So these are some of the Indian authors which you can use. Unlike anatomy, we don't have lots of other books, except for a lot of universities are also talking about immunology in biochemistry. So that is one part for which you need an additional book in most of the cases. So for the reference book for immunology, you can use the QB's immunology, but we generally, the students don't need that. We have a very good simple book from an Indian author. Dr. S.K. Gupta has simplified the immunology content, which you can very easily cover from that book. So for biochemistry, one main textbook, and a little bit for immunology for some of the universities, not all the universities, but some of the universities. I'll hand over to Dr. Naveen sir for
Nilesh sir, I want to ask
Yes.
one question. In
Yes,
my
sir.
MBBS first year,
Yes, sir.
whole year I struggled for biochemistry. पूरे साल मुझे biochemistry समझ में नहीं आई. And exam date was released and I have only 15 or 15 days like that. So हमारे senior ने बताया Lippincott Illustrated. तो सर मैंने उस book को पढ़ा.
Yes, sir.
I just gone through the tables and charts and flow chart.
Yes, sir.
And they helped to clear my biochemistry examination. I'm very poor in biochemistry, sir.
Very good point, sir. I did not mention that book because now we have the next exam, and that book is easy to read. And for the theory exam, it is easy to reproduce because a lot of flowcharts, etc. there. But long-term retention for Lippincott is number one, slightly less. And number two, it does not deal with some of the important topics being asked in our NEET, which will now become the next exam. So for Indian students, if you only want to pass the university exam, then Lippincott is a very good book. But if you're looking at the long-term target, then I would say that Lippincott is only like a key, which is for the university exam. In long term, it has quite significantly lower yield for our NEET and next exam because all our students have to go for next. So this year, I have not used the Lippincott as one of the reference books. Previously, we used to mention that, as you rightly said, because at that time, the NEET exam used to be very far and it was not a do or die exam for all the students because you appear for the NEET exam after you get the degree. But now we have to clear the next exam to get the degree. So there we have to choose the books very, very carefully, which will help us in both the university exam as well as the next exam. So in this parameter, the Lippincott slightly fails that it will not carry us through the next exam, sir.
Thanks a lot for clearing my doubts, sir.
Sir, over to you, sir, for physiology, sir.
Regarding physiology, sir, I must say that Ganong is just like a Gita, or you can say Bible, whatever, because the reference book is Ganong. In physiology, there are so many, controversies. In Guyton, some things are different. In Ganong, something are different. But Ganong is a best reference book. So every student must always have a Ganong throughout his medical career. Even if he has to study medicine also, he have to look for Ganong. But of course, you cannot understand anything from Ganong. The thing is that, of course, it is a collection of information, just like your Harper. It is just like a notes. So if you want to understand the topic, Ganong will never help. In that case, Guyton, especially the kidney portion, if you want to understand the kidney, it is best given in Guyton. Guyton is best for kidney. So I think if I want to retain something in kidney, I have to study at least from Guyton about the kidney. And Ganong is a reference book. And the Indian author books, there are so many I have gone through. And I must say that Dr. G.K. Pal book and also Sabyasachi Sarkar, they are lucid and they are simpler. So thing is that considering the time is very less. And whole year they will not study. From morning till 5 p.m. they are in the college. Then they will relax. Only 1 to 3 hours they can study per day. So considering that they are not a scholar, they are doctor, they have to enjoy their life also. So thing is that they should not end up reading all the times. So thing is that they should attend their classes in their medical colleges. First of all, they should attend their all teachers. They should regard their teachers because classroom teacher is very, very important. They can go through the videos, the apps. And in doctors, we know there is UG curriculum also launching, especially designed for the, curriculum wise. So after going through the videos, through the classroom teaching, okay, they should not skip all the classes and all. And then after class, if they start reading the Ganong, then they will understand what is the purpose of this line. So Ganong everyone should have, number one. Number two, if you want to have some Indian book, then GK Pal is good. Then Sabyasachi Sarkar is also good. And then one more book, Chatterjee. Chatterjee is also good, but it is very, very concise. But I will always put focus on the classroom teaching or the video lectures or the app-based, because suppose that I am teaching physiology for last 10 years. So I want to concise everything. I want to save the time of the student. For example, initially I was not able to understand how metabolic alkalosis cause tetany or how hypomagnesemia cause tetany. Now, after 6 years, when I study Harrison, then I understand, okay, this is the reason. So I will put that 1 month, hard work into one line. So if they go to their teachers in their classroom, in their app, as well as along with their Genong book, of course, they will ready to understand their concept also. So mere hisab se, they should never skip the classroom. On books are only the reference. Teachers are the living book. So they should regard their medical college teacher. Every teacher has a whole history of them. And if they cannot understand in the classroom, then they can go to the video lectures and all those. And after that, only then, my father is also a doctor. So जब मेरा MBBS में हुआ, मेरे पापा से पूछा कि कौन सी बुक ले लूं, तो उन्होंने कहा कि books is only for reference. Go to the classroom. और उस टाइम पे एप्स तो आते नहीं थे, तो we were not. तो हम लोग टीचर के पीछे भागते थे, सर ये टॉपिक सर रेजिडेंट के पीछे भागते थे. So teachers are the living books, so they should respect all the teachers in the college. And even after that, they can refer their apps. And of course, Genong, they should always carry. After that, they can understand what is written in the Genong. So this is my advice to my fellow students.
Absolutely. Absolutely. I was just seeing the comments over here. Yes, Atharva, yes, at Doc Tutorials, we do have UG curriculum also. We are coming up with that one. So don't worry about that, because we are going to take care about the students from first year onwards. So it is not even for now. Dr. Tutorial is not only going to cater only to the NEET PG or FMG students. We are now going to have a hand-holding experience for all the students from first year MBBS itself. Is it okay? Now, saying that, Nilesh, sir, to you, sir, we have actually now, I think, in the right way, informed the students like which books to follow and in which order to follow. So, Nilesh, sir, can you please tell me like how our videos are going to decode the standard books, as we have said, like Harper's and all those things. So, how we are going to simplify that in our videos, sir?
So, sir, just now Dr. Naveen said that he used to have some problem with understanding metabolic acidosis and tetany, and then he spent a lot of time over Harrison, and he cleared his concepts, and then he has brought the summary of that knowledge in a very simple content in his video. So that is what all of us have tried to do. We have utilized all the reference books. We have identified the pain points for the students. We have gone to all the higher reference books. For example, for biochemistry, I would go to Lehninger, I would go to Voigt and Voigt, I would go to Stryer for any pain points for the students, and then try to collect all the relevant information, crystallize the pain points in very easy, simple to understand statements, if required flowcharts, if required hand-drawn diagrams, so that the picture is formed in the mind of the students. They're not just reading a line. When they look at that line, immediately what we have shown in the form of flowcharts and diagrams, that flashes in their minds, and they are able to link it very, very easily. So that is the effort that we have put in our videos. We have taken all the standard textbooks, we have identified the pain points, and we have simplified it with the help of very easy to understand flowcharts, diagrams, and at a lot of places, for example, in anatomy, we have used a lot of 3D animations for the students, so that it is very, very easy for them to visualize, and it is very easy to retain. So this is going to be a very helpful thing. Like Dr. Naveen said, that it is very important to attend the class. But a lot of time it happens that during the class, you are not able to give the full 60 minutes of your attention span, and you might miss out some points. So that is where our app will be extremely helpful, because it is in your pocket and you can rewind and review any part that you have missed, any part where you're not confident. You can watch it once, you can watch it twice, you can watch it even 3 times if you want to reinforce some topic which you are not very comfortable or confident about. So that's the aspect of the app. It is like a friend in the pocket for the first year especially students, when it is very, very daunting when we enter the MBBS course. Oh, there is so much to do in the school. We had so much fun, and here it is so difficult, so much syllabus to cover, so little time. So you're hard pressed for time. So that is a sense of comfort that the student can get. Okay, if I have any problem, I can go back to Dr. Azam sir and I can quickly see the lecture on spine. Today the discussion was there. I was not able to understand. So I'll go and see Dr. Azam's video, and again I can review and recap the things that were discussed in the class. So that's how the things will work for the students, and it will be a source of comfort, source of knowledge, and source of clarification for their topics.
I can see a lot of comments. First of all, I want to thank all the students for wonderful comments, for our encouragement. So thanks a lot, Athar, Pawan, everyone. And thanks, Dr. Vandapuri ma'am, for encouraging us. And I am really loving to discuss with these two legends, Dr. Azam sir, Dr. Nilesh sir. This is really very, pleasure discussing, because I have seen that Dr. Azam is going to a lot of countries like Kyrgyzstan, Kazakhstan, Philippines, everywhere, and guiding so many students. Dr. Nilesh sir, they have so much experience. So these experiences I can hear, and I am really very happy that all students are hearing this. And one thing I want to say also, if Dr. Nilesh allow me.
Of course.
Please continue.
Okay.
Go ahead, sir.
Just see what I have seen in the recent papers. There is a lot of difference, because initially they want to ask like write a short note on shock, write an essay on regulation of BP. Now, if I see the paper of physiology or anatomy, they are not asking the direct question. Now, students are very much confused, although they know what is regulation of BP, what is shock, but they don't know how to apply that in the examination question. So, can I discuss few things that from the recent
definitely,
paper?
sir. Definitely. Please continue, sir.
Absolutely. Meanwhile, the sir will be actually sharing his screen right now. Naveen sir. So meanwhile, I'll tell you all my dear students who are actually now entering into first year MBBS. Nowadays, the exam pattern has been completely changed, as sir is telling, because when we wrote our exams, it used to be a straightforward question, like write a detailed essay on, mammary gland or something like that. But nowadays, it's not like that. The long answer is being asked in the clinical format. The long answer and is asked in a clinical format, I'm telling you. And apart from that, short notes and very short notes are there. And apart from that, nowadays they have even included the multiple choice questions in the exam also. So that is what sir is trying to share with you people. Just observe this very carefully here, sir. Yes, sir. All to you, sir.
Sir, is it all? Am I audible and visible both?
Yes, sir. Screen is clearly visible.
This is a recent
And you are
paper
also
for
audible, sir. You are also audible.
See, this is the latest pattern of examination. So first question was long answer. They have given history of 55-year-old manager having a deep sleep and realized that when she wake up, okay, she has fainting sensation. Okay, and she said that heart was racing. And the first question, that was 5 number, what is the most probable cause of her lightheadedness and fainting sensation? Second question, what is the name given to such condition? And third is her lightheadedness was transient and she recovered soon. Explain the mechanism. So this question is of 15 marks. And this question is only regarding regulation of BP, nothing else. This must click that when you are in supine position and if you wake up, there's a pooling of blood in the legs and there is a syncope. It is an orthostatic hypotension. So you have to mention about the orthostatic hypotension. And the third question of 8 marks is only about regulation of BP. So now they are not asking the direct question. Write an essay on regulation of BP. They will give you a clinical scenario. Number 2 question will be a short note. And see, all questions are clinical. What is decompression sickness? What is distributive shock? What is heart block? So if you read Ganong or Guyton from line to line, you are not able to solve the question. So you have to go to the curriculum given by NMC guidelines. Only those questions are asked. Okay, topic wise. Then third question is about short note about the, see the question, physiological significance of FRC. They have not asked about the FRC. They have asked about the significance of FRC. And I'm checking the copy and I'm seeing that no one is writing about the significance. They say this is FRC, that's it. Second question is that what is AV nodal delay and the significance? Again, the conceptual question. Third question, what is FEV1 and the clinical significance? What are the 2 changes in the ECG during MI? So can you see this? They are asking directly the clinical question. They are not asking about what are the leads of ECG. They are asking the clinical question. So if you go through the books line by line, you are not able to attend this question. So see the curriculum first. Attend your class. And then if you want to see the video, you can see the video. In our NEET UG video, we are delivering the lecture in the form of curriculum, in the form of the significance. And the MCQs are also asked nowadays. Don't think that MCQs are only for NEET PG. So you can see 10 MCQ, 20 MCQ in one paper. And second question is about the referred. See, a 38-year-old boxer sustained a job of lower job. This whole clinical scenario was just to ask the pain pathway. Suppose you know the pain pathway, but you cannot interpret the question. What is the referred pain? What is the endogenous analgesia? Then physiological change in the pregnancy. This is a recent trend in the pattern of integrated physiology. If you see the curriculum, you can see this is given the topic, physiological change in the pregnancy. It is not even given in Genome, not even given in Guyton. Even if you become master of Guyton and Genome, you cannot solve this question. Are you getting my point? So thing is that books are only for reference. First see the curriculum, see the topic, and then go to your teacher and then to the books. By this, you can save your time also, and also you can build more concept clinically, because these books are basically, pure physiology book. Otherwise, if you want to understand physiology, you have to read Harrison, because actual physiology is given in Harrison only. Then see, you can see here about the biological clock, function of middle ear, safe period, anion gap. Dr. Nilesh will also teach anion gap in biochemistry. We will also discuss anion gap in physiology. Initially, these things were not being discussed in Genome as well as in Guyton. For that, you have to refer to your teachers. These are the extra topics which is added in the curriculum. So even if you are a good student, but if you don't have guidance, then you cannot crack your examination. So my humble and honest advice is that save your time. Okay, always refer your seniors, go to your seniors, they have given the examination, ask them how they have cracked, go to your teachers, refer the videos. There are PG videos as well as there are NEET UG videos, and they are always based on the curriculum wise. Okay, so this is only for just example. There are so many questions, I cannot discuss them, but this is just an example how question patterns are asked. They are asking the clinical scenario, they are asking the clinical significance, they are asking the physiological relevance, and for that concept is needed, not the essay. Because I've been telling you again and again that you want to become a doctor. Of course, you don't want to become a scholar. We are not doing BSc or MSc or PhD. Here we all are going to become doctor. We want to see the patient. So the purpose of NMC is to summarize everything, concise everything, and make it more relevant in favor of student, that they have to become a medical officer. They have to become a physician. Because when patient come, you will not write essay on counter current. You must know. For example, if I study counter current mechanism, then the pump NKCC, if mutation is there, it can cause Bartter syndrome. If you block that pump, it is a loop diuretic. So how pharma, how pediatrics, how medicine, all linked together. And if you do it only from your book, you will get only concept of physiology. So always go to your teacher, to your senior, to the app, to the videos, and make your own notes of that, so that before examination, you can revise all those notes. So a lot of questions are coming because they are integrated with your medicine, with the anatomy. There is a vertical integration, there is a horizontal integration. For example, anion gap, it is integrated with biochemistry. Okay, like these pathways, these are integrated with the anatomy. Okay, like menstrual cycle, the same question was in anatomy as well as in physiology. So these topics are integrated with the anatomy, physio, and biochemistry. And when you go to second year, physiology will be integrated with pharma, patho, and medicine. Anatomy will be integrated with surgical branches like ENT, Ophtha, as well as surgery. Biochemistry will be integrated everywhere. Okay, so this is the purpose. I hope Dr. Nilesh sir and Dr. Ajam sir is agreeing with me.
Definitely, sir. I would like to add very small points here, particularly for the questions that you said and for the applied part that you said. In the clinical question, it is very, very common problem with the students to miss out on one or more sub parts of the question. So you have to be very, very careful when you attempt the paper, that you don't get lost in the clinical case. You identify the questions which have been asked, point out, okay, question A, B, C, D, 4 parts are there. And when you write the explanation, you make sure that you covered all the 4 parts A, B, C, and D. Very commonly, when we are checking the paper, we see that students have answered A, B, and C, and they have lost the answer to D. They have not written the answer to D. So please make sure that you have the all the parts of the question covered. They are very well covered, otherwise you lose marks. Second part which sir said about the applied part, the applied part is very, very important. Why it is important? Because like sir said, in the textbook the basic content is there, but the applied part is the requirement of the NMC curriculum, and this will be covered only by the teachers. All right, please understand, this will be covered only by the teachers. So if you are missing out on the lectures, then you will be in a problem when you face the paper. All right, so please make sure that you are attending the lectures, or you are supplementing those lectures with the videos prepared by Dr. Naveen sir, Dr. Agzam sir, or my lectures, where we have fully covered the NMC curriculum. Our lectures are strictly as per NMC curriculum, part 1.1, part 2.1, 2.2, 2.3. We've covered all the points which have been put in the NMC curriculum, where the NMC curriculum talks about applied part, and this is not very, very apparent in the books. New books are coming up which are as per NMC curriculum, but generally the first editions require some improvement before we can start referring them for the students. So as of now, the standard books for the basic content and the faculties for the applied part, without which you cannot cover the complete curriculum.
Absolutely, absolutely, sir.
Yeah, absolutely, sir.
So
absolutely.
moving ahead, sir. So, like for all the students who are actually listening to us right now, I'd like to just sum up here, like what we are trying to tell here, or what we are trying to actually inform you, like beforehand, before the exams, is that okay, the question paper pattern which is being asked nowadays has been completely changed. Until and unless you have a holistic approach, a complete approach of the subject, you will not be able to answer that one. It's not like straightforward, write an essay on this one. No, you have seen live here. Naveen sir has shown you the question, clinical question there. There is no word written there as hypertension or hypotension, orthostatic hypotension. कुछ लिखा नहीं है, आपको समझना है, और समझने के लिए आपको लेक्चर अटेंड करना पड़ेगा. That is what sir is trying to summarize. And now coming to my subject, anatomy, I'll tell you like how we are actually going to come up at doc tutorials in UG curriculum. In UG curriculum, like what are the videos I have recorded and how they're actually going to help you. So as sir has decoded the thing, what I have done is that, yes, you have a lot of books in anatomy, a lot of standard books, and they're like huge volumes. And if you start that, you cannot do that directly. So my thing is very, very simple in anatomy. The first thing is that all the students who are listening to me right now for the first time, and the students who have already attended my class, they know very well the way I take the class in anatomy is like by diagram. Like you have to actually draw the diagrams along with me. And that is going to help you in like multiple ways. जैसे एक तो कहावत है, like one thing is saying is there कि a picture is worth 1,000 words. So in that way, I'm trying to tell you that don't have phobia of anatomy in your mind. Actually, anatomy is very simple if you go and deal it in a pictorial manner. For example, I'll tell you one example. In upper limb, we study about the axillary artery. And for any artery, you have to learn the branches. And those branches in the textbook and all, it is given in paragraph manner, only in sequentially like 1, 2, 3, 4, these many branches are there. I never teach in my classes in that manner. We literally draw the diagram of axillary artery. And believe me, my dear friends, if you draw the diagram once, diagram or pictorial memory will be for long term. So first thing, welcome to the UG curriculum videos in doc tutorial. Like all the videos of anatomy, in anatomy, we are having a diagrammatic approach. So one thing, it is helping you in understanding the concept quickly. Second thing, long term, you are able to retain that one. And third thing, with the help of diagram, is that in your prof exam, also during the exam, you have to draw anatomy diagrams. And my dear friends, the moment you see a complete picture of scapular anastomosis, और एक्सिलरी आर्टरी अगर आप सारा पिक्चर एक ही साथ में देखोगे, इफ यू जस्ट लुक एट द पिक्चर वंस इन योर टेक्स्ट बुक, यू विल गो मैड वेयर टू स्टार्ट विद, वेयर टू एंड विद, इसको डायग्राम को हम कैसे ड्रॉ करें, हाउ टू अप्रोच दैट, हाउ टू मेक इट इजी. तो that is how the videos will also help you in your prof exam also to draw the images, and I'm going to literally draw the images along with you people. So that is why I'm telling you the advantage of watching all these things in our UG curriculum pattern of videos that we are coming up with. And second thing I'll tell you in anatomy, apart from diagrammatic approach, second thing is order of topics is extremely important, I'm telling you. I like why? Because whatever standard anatomy textbook that you refer to, whether it is Gray's Anatomy or BD Chaurasia or whatever it is, order of topics is very much important. For example, I'll tell you one thing here. In neuroanatomy, in the very beginning, they have given about ventricles. And when you learn about the ventricles inside the brain, आपने 11th or 12th standard में पढ़ाई होगा ventricles के बारे में, lateral ventricle, third ventricle, fourth ventricle. And now those ventricles, you have to learn the boundaries. The problem is that the moment you start learning the boundaries, they'll be like corpus callosum, you'll be having fornix, you'll be having chordate nucleus, all those things will be there in the boundaries. Now, suddenly that is given in the very beginning of the topic, beginning of neuroanatomy in any textbook, you see the ventricle and the boundaries are given in the beginning. And now the student, as a first year MBBS student, for example, I'm a simple student, I'm getting confused now. What is this chordate nucleus now? So my dear friends, again, I'm going to tell you, you might be feeling like, I'm telling it again and again, but yes, the order of topics, you will find it in a very neat and clear manner and in a very conceptual manner in our doctoral videos. So I have arranged in such a way that, after learning all those topics, you'll easily able to follow the ventricles. Similarly, it happens in head and neck also. In head and neck, like triangles of neck is a long answer question and all for your prof exams. And directly students are going to learn about triangles of neck. Na, aisi galti bilkul mat karna. You have to learn that at the end of head and neck, after learning all the topics here, the fascia and all. So guys, like what I'm trying to tell you in your first year MBBS, to approach anatomy in a simple manner, pehle maine aapko sari kitabein batayi thi. I told you about all the books, and then I'm now telling you how to use my videos actually. And for decoding those books, first we're going to have a diagrammatic approach. Second thing, we are going to have a conceptual approach. And third thing in my anatomy videos is that you're going to find a proper order of the topics so that you can follow one topic after the other. So that is advantage. So welcome to our platform. And that is how I'm going to make anatomy easy for you people, guys.
Sir, one
moving
simple input
Yes,
that I would request from you. You
sir.
travel all over the world and interact with the students. Can you highlight 2 or 3 common apprehensions that these students have when they are entering the MBBS, not only in our country, all over the world?
Sir, apprehensions when it comes to when they come into the first year MBBS, I'm telling like the same thing. Recently, I was in one of the medical college here, NIMS Medical College. I went there. They're also the same apprehension. I think I should not disrespect anyone with this one. I'm not disrespecting anyone. With all due respect to all the faculties, sir, because you have raised the question, I'm telling you, apprehension, one thing which I commonly listen everywhere is that the like in the medical colleges and all, with all due respect, I'm telling again and again, don't make it like a controversy or something. So like the PPT kind of rating or the ready-made diagrams, like brachial plexus है तो मतलब उसका बस पिक्चर ही बता दिया. अब like students को सर पता नहीं है कि अप्रोच कैसे करना है, कि brachial plexus मैं ड्रॉ कैसे करूं, how to draw that approach. So इसीलिए मैंने वो पॉइंट अभी इसीलिए कहा था actually. तो everywhere sir, throughout India and even outside India, I'm telling you same thing. So directly we are able to see PPTs on the screen there, and we don't know how to approach the topic, and we don't know how to remember the order of the topic. So that is the thing. So images draw करना नहीं आता है sir, कि कैसे draw करें. We have never drawn the image in our first year MBBS days, something like that. So these are the common apprehensions about when it comes to anatomy. So when the students come and tell me, so with due respect, all the faculties are very good. They are working hard. They are trailing the subject very nicely. But a slight change at our platform here, I should say.
Wonderful, sir. So that's the difference of being interactive with the students and taking the apprehensions and the pain points of the students, which we have tried to incorporate in the content that we have created. We have tried to sit on the other side of the bench as students, and we have tried to internalize what areas are the stumbling blocks for students. Try to identify those points for the students. Sir, Naveen sir, are you here?
Yes, sir. Yes, sir.
So, your inputs from your side, sir.
सर आई वांट टू डॉक्टर आजम सर ने बताया कि एक डायग्राम पूरा का पूरा बना हुआ है, फॉर एग्जांपल बेसल गैंग्लियन, समझ में नहीं आता कहाँ से स्टार्ट है कहाँ पर उसका एंड है। तो जब टीचर उसको फ्रॉम पॉइंट ए टू पॉइंट जेड उसको जब ड्रॉ करता है तो दिमाग में उतरने लगता है कि ये यहाँ से बेसल गैंग्लियन है, ऐसा ऐसा ऐसा। दिस इज वेरी इंपॉर्टेंट। सो देयर इज अ टेक्निक, आई मस्ट हाईलाइट अलाइनमेंट टेक्निक।
बिल्कुल सर, बिल्कुल।
फिजिसिस्ट तो वो कहते हैं कि जो पढ़ना है पढ़ लो, फिर किताब को बंद करो, एक ब्लैंक पेपर लो और जस्ट राइट डाउन व्हाटएवर यू हैव लर्नड। आप देखो कि आपने क्या याद किया है, फिर भूल गए फिर से देखो, फिर बंद करो। क्योंकि व्हेन वी कीप ऑन रीडिंग द सेम नोट्स अगेन एंड अगेन, देयर इज फैलेसी ऑफ थॉट दैट वी नो एवरीथिंग। लेकिन जब हम प्लेन पेपर पे लिखते हैं, अरे यार ये इस आर्टरी का नाम क्या था, इस वेन का नाम क्या था, ये डायग्राम कहाँ से गया, सो एज इफ आई एम टीचिंग समवन। तो फ्रॉम माई चाइल्डहुड, मतलब मेरा एक पढ़ने का तरीका रहा है कि मैं पढ़ाने की कोशिश करता था कि मैंने कुछ पढ़ लिया, अब उसको ब्लैक बोर्ड ले लिया और मैं किसी को पढ़ा रहा हूँ, कोई नहीं, मैं अकेला हूँ। बिकॉज अगर मैं तभी पढ़ा सकता हूँ इफ आई नो द होल कंटेंट कंप्लीटली, माई कंसेप्ट्स आर क्लियर। सो हर स्टूडेंट का ये फर्ज है कि वो किसी को पढ़ाने की कोशिश करे। अगर उसको समझ में आ गया है, अपने रूम पार्टनर को, अपने दोस्त को, ऐसा नहीं होता कि नॉलेज घट जाती है, उसको आ जाएगा यार, ऐसा नहीं होता है। इफ यू टीच, इफ यू गिव, इट विल इंक्रीज एक्सपोनेंशियली, ये बढ़ती है चीज। तो my thing is that MBBS is, of course, it is a very tiresome job and you have to enjoy your life also. So our purpose is not to make you very serious, dead serious of the life. Life is not a serious phenomena. The more seriously you take, the more you are losing the life. You should not be that serious. Seriousness does not mean long face. मतलब नहीं कि लॉन्ग फेस को बैठ गया यार, हम तो पढ़ी इंसान हैं, हमसे पढ़ाई करेंगे। नो, सीरियसनेस मींस कि अगर आपने सोचा है कि टुडे आई हैव टू फिनिश माय न्यूरो एनाटॉमी, so I have to finish it by today. This seriousness.
Sir, one of the questions I'm getting here in my WhatsApp, sir, one of the student is asking that suppose that Doc Tutorial is having both. Yes, Naveen sir. If Doctor is having both NEET PG videos as well as UG curriculum videos, like what's the difference that we are bringing in for them?
This the same thing which I wanted to bring, that we have videos for UG curriculum also and for PG curriculum also. What are the differences? How they are different? Naveen sir, would you comment?
Yes, of course, sir. See, in our PG study and NEET PG examination, there are 19 subjects. So our purpose is to just cover each and everything so that we can solve MCQ. This is the purpose. But when we join a medical college, in first year we have only 3 subjects. We have enough time. So our purpose is to build the concept here. They are the young minds. They have enough time. They can study. Number 1. Number 2. In UG curriculum, we are discussing each and every topic given in NMC curriculum, like PY 1.1, PY 2.2. So each and every point, for example, integrated topics are not given anywhere in the books. They are not given. And if I see the paper, there are 4 or 5 questions from integrated physiology, from integrated biochemistry, from integrated anatomy. So in our UG curriculum videos, we have tried to cover almost everything. For example, my PG videos are only 40 hours. But UG curriculum will be almost 80 or 70 like this. Second thing in that, in UG curriculum, we are standing and animations is going on. A lot of animation. A whole team is there who's making all the animations. For example, if I'm discussing the cardiac cycle, you can see the heart, how blood is pumping out. You can just visualize everything. If I'm discussing about the cerebellum, you can discuss every part of the cerebellum. If I say finger nose test, you can see a patient there. He's doing finger nose test. So best part of the UG curriculum, of course, it is taking a lot of time and also a lot of effort. But when it come out, of course, it will be the wonderful for the first time in the whole world. It is coming for the first time till date. No app is like this in which you have full curriculum. Either they are USMLE based or they are NEET PG based or FMG based. For the first time, we are going to cover whole curriculum A to Z. Nothing is left. Absolutely. And also with a great animation.
Yes, sir. I think that answered your question. The person who's asking me, like, what is the difference between NEET PG and UG curriculum? In UG curriculum, like as sir is telling here, we are actually going to follow the CBME curriculum, that competency-based medical education curriculum that is set up by NMC. That is the curriculum we are actually going to follow. And when it comes to like my subject, I would like to tell that, I'm going to deal with the entire BD Chaurasia, like line by line and page by page. That should be like the summary. And when it comes to NEET PG, NEET PG is like, there is a proper protocol in that one. There are like set topics which are like most frequently asked, and we are focused on that very fast and quick in that one. But when it comes to like UG curriculum here, we are going to follow the competency based one as said by the NMC guys. Okay.
I'd
Yes,
just like to summarize.
yes,
I'd like
yes,
to
Nilesh,
summarize what both the experts have said. So basically, in our UG content that we have created, we are trying to build your foundations because we have enough time. We are trying to give you images, mental pictures, which will help you understand and retain things. So we are building the concepts. We are building the foundation. But when we go to the PG lectures, there we are actually racing against time because the students have to cover 19 subjects and they have to reproduce that content in one setting of the exam. So we are trying to be concise. We are trying to be useful. We are trying to highlight the very, very important and commonly repeated topics in the PG videos. Whereas in the UG videos, we are trying to give you the wholesome picture. We have, as per NMC curriculum, included the applied part and trying to build the base, the foundation over which the whole of your medical knowledge will rest. The first year is the base, the foundation over you will build the knowledge of all the other subjects. So that is what we have tried to do in the UG videos, which are completely different from the PG videos. So, and that's the answer to the questions.
Thank you, sir. And now the last and final thing I would like to focus on is we have discussed about the books and we have informed all the students about like how to use our videos along with the books. And we have also informed them how to approach each and every subject. I think that is well said by all the faculties over here. Now, just to end this thing here, sir, like that is a question from my side actually. Just to end this, should this, yes, Naveen sir, first of all, should the students also solve our question bank along with our UG curriculum videos? Like I mean to say the multiple choice questions that we have even in our question bank and test series. What would you say, sir, on this one?
Sir, as we can see in the recent paper, which was almost 15 days back, we can say 40 MCQs.
Lovely.
40 MCQs in one subject.
Lovely.
Those were not easy MCQ. Those all were tough MCQ. So 40 marks is a good mark, sir. So I must say that they have to solve MCQ nowadays. Because initially they have to answer only the essay type question, but now most of the time they have in one paper 20 MCQ. There are two paper 40 MCQ. So the question which are in doc tutorial, the question app, we can see they are very well curated, they are clinical and they are applied. And I can see this time also almost all MCQ were from our app only. Definitely. Yes. Otherwise also, sir, when we solve MCQ, a lot of concepts are clear. For example, sir, we know if they ask, we have studied whole basal ganglion, but MCQ will come, which is the only nucleus that is excitatory. It is subthalamic. Okay. So like this, after studying whole topic, we cannot solve MCQ. So only by solving the repeated MCQ, we can be thorough in that. So intelligence in doctor, intelligence is important, but diligence is more important. The revision.
Very aptly put, sir. That is what we always tell to the students, that once you do the questions, you have twin benefits, your concepts are cleared, and whatever you have read is reinforced. So yes. Even if the next was not there, I would tell the student that you have to do the MCQs. Otherwise, the complete picture and the confidence in the topic is not there. Once you've done the questions, then you know that, okay, you have the grasp on the topic which you have covered. So that is very, very important, because half the challenge is being confident we are answering the question. So that is half the battle won once you've done the MCQs.
Exactly, sir. मैं आप दोनों से exactly यही actually ना जानना चाह रहा था, और ये बात actually students तक पहुंचाना चाह रहा था कि not only videos, not only the books, yes, there is a great emphasis that you have to put on solving questions also. So please utilize the question bank as well as the test series that is in our app. It's not about only just listening to our videos and going back and referring to textbooks also. Question bank is also important. मैं actually आप तक यही बात पहुंचाना चाह रहा था. I just want to share this thing up to the students. Yes, sir. I think that is like well said. So now there's just the closing comments, just to end this live session here. I think we have given enough of information for the students to handle. So now, first of all, from Nilesh sir, what will be your closing comments on this one, sir? What is your message to the students, first year MBBS students?
So first is congratulations and welcome to the MBBS course. You have achieved a very big important victory in your life. It is a very important and good achievement, but that is only the beginning of the battle, because the medical course is a long one. We don't just end with MBBS, we go to specialization, we go to super specialization, and for that the foundation is very, very, very important, which you cover in the first year. So it is equally important, like the next exam, to give our best effort in the first year and to utilize all of the resources that we have available to build our foundation. Like we mentioned, you have the reference textbooks, you have the Indian textbooks, you have your faculty in the medical college, which are helping you in your curriculum. So I would say that it doesn't make sense to not use the additional resource of the very lucid lectures in your pocket in the form of the app, which the faculties have put in so much effort for you to simplify the content and make it pictorial, easy to visualize. So I think it would be a very, very good idea to make use of this additional, very useful resource for yourself.
Absolutely, everything. Yes, sir. Naveen sir, after you. What is your message to the students, sir, first year MBBS students?
Sir, I always say, don't go after the motivational video. Study hard. Motivation is a myth. See, confidence is a pseudo word. There is nothing called as confidence. Confidence comes from real knowledge. Dr. Ambedkar ने कहा था कि the knowledge is the knowledge. क्या होता है? शेरनी का दूध है, जो पिएगा दहाड़ेगा. तो go after the knowledge, go after the concept. तो जो आपका knowledge आएगा तो वो confidence real confidence होगा, pseudo नहीं होगा. कि आपने टाई लगा लिया, कोट पहन लिया और डॉक्टर बन गए, वो कॉन्फिडेंस सूडो है. जब नॉलेज होगा, देन योर फेस यू विल ग्लो लाइक एनीथिंग. वो कोई भी हैंडसम क्रीम और कोई भी नहीं करेगी. सो गो फॉर नॉलेज, बिकॉज यू वांट टू बिकम डॉक्टर. तो अब आपकी जो आपकी स्ट्रेंथ है वो नॉलेज है. कोई आपको कुछ कह ना सके. वो गालिब का शेर याद आ रहा है कि हर एक बात पर कहते हो तुम कि तू क्या है, तुम ही कहो ये अंदाजे गुफ्तगू क्या है, और रगों में दौड़ते फिरने के हम नहीं कायल, जो आंख से ना टपका तो फिर लहू क्या है.
Wonderfully said.
क्या बात है.
So just go for knowledge. Have respect for your teachers, for your college teacher, for everyone. See, teacher means anyone who is giving you knowledge. So go after knowledge. Rest all is just, it will happen automatically.
Absolutely, sir. Well said, sir. So that's all, guys. I think you can take home all the points, the important things, and this is going to make your journey a little bit easier in your first year MBBS. And of course, always we are here to help you out, guys. Okay, so that's all for today's session. I think you have got enough of the things clarified. If any time, you'll just let us know. We are always here to help you out. So me, Dr. Naveen sir, and Dr. Nilesh sir, we are always there to help you out through your entire MBBS journey in your first year, guys. Okay, so hope all the best. God bless you with lots and lots of success in your life. All the best for your first year, and welcome to the medical fraternity. Thank you, guys.
Thank you, everyone. Thank you,
everyone, and best